And good afternoon, everyone. Thanks for joining us on this Monday. Today, Orange County Mayor Demings will discuss our current COVID-19 case numbers. A bit of good news in those numbers. Mayor Demings will also discuss our micro grant program for home-based businesses, which launched this morning. He'll talk about CARES Act funding and more. Orlando Mayor Buddy Dyer sends his apologies as he is not able to make it to be with us this afternoon. Dr. Raul Pina from the Florida Department of Health in Orange County has information on our testing numbers, testing timeframes, and additional information and other important data as well. And with this being the first day of school, with us today is Dr. Barbara Jenkins, the superintendent of Orange County Schools. She is here with updates and other pertinent information. We begin with Mayor Demings. Mayor?
All right, good afternoon, and let me say welcome to Dr. Jenkins. I had the opportunity this morning to observe my 7-year-old granddaughter logging into the system with her father and attending the first virtual day of school for her. And so that was quite the experience to watch that occurring. So let me just say also thank you to the teachers and to your entire staff that's helping to make certain that our children get a good education. And let me just kind of move forward and talk now. As schools reopen virtually, I also want our parents and teachers to know that we are seeing an encouraging trend in terms of the numbers here within Orange County. Today we're going to talk about those numbers quite a bit. Orange County has a total now of 31,851 cases of the COVID-19 within our community. That is an increase for one day of 133 cases, and once upon a time I wouldn't be celebrating, if you will, in any way 133 new cases, but when we look at that relatively within the last few days, that's the lowest number day over day that we've seen now in quite a few months. Sadly, though, we still have 298 people who have died of the coronavirus in our county. That number is unchanged from yesterday, so it is the first day in a while where we had no new deaths, and our goal is to make that the reality every day. I also want to share with you some information about Orange County's positivity rate. If you look behind me, there's a quick snapshot of where we are. Since we started documenting all of the coronavirus cases in March, our overall positivity rate is now at 11.6%. The statewide overall rate is 13.3%, so we are faring better than the state of Florida at large. But I also want to call your attention to the day-to-day positivity numbers here within Orange County within the last 2 weeks. Our numbers are all in the single digits. This is really encouraging news for our students as they go back to school. If you look at the numbers there behind me, the latest numbers released today shows that a daily positivity rate was 6.8%. You can see on the graphic for the 14-day period of time, the numbers range from 5.9% on August the 1st to 8.9%. That was the highest within the 14-day period of time, and that was on August the 4th. So all of our day-to-day positivity rates within the last 14-day period of time have been in the single digits, not the cumulative rate. And sometimes when Dr. Pino shows numbers, he's showing that cumulative rate coming down over time, but within the last 14-day period of time, the numbers have all been in the single digits, and so that's good news for us. Today marks the 151st day that our Emergency Operations Center has been activated. And as we start the week off, each week I try to give you the goals that we have in mind for the week, and I'm going to do that. Our number one goal is always to stop the spread of the virus within our community. But in addition to that, we have some other goals this week. Number one, to continue to provide financial relief to our residents and businesses, and I'll talk more about what we're doing in that regard. Number two is to make sure our residents are aware of the testing that is available countywide and provide for that testing. We'll be talking about how we're going to provide for testing within our community. And lastly, to continue to distribute personal protective equipment throughout our community. I'll give you some numbers on that as well. This morning at 8 a.m., our micro grant program for home-based businesses was launched on our Orange County Cares portal. We had some 1,200 individuals who submitted applications through that process. These were home-based businesses which could receive micro grants up to $3,000. For small businesses, their program has processed more than $42.5 million in grants for more than 4,500 small businesses in Orange County. Again, if you're a small business, 100 or fewer employees, you can go to our website and visit our website at ocfl.net/Orange Cares to make application. For the Orange Cares Crisis Assistance for families and individuals, more than $18 million in checks have been processed by the Comptroller's Office for mailing. A total of 28,748 applicants have been approved through the Individual and Family Crisis Assistance Program. I say to everyone that's made application for the Individual and Family Crisis Assistance, be patient with us through that process. You've heard this before, the check's in the mail. Tomorrow, the Board of County Commissioners will be asked to approve $20 million in CARES Act funds to assist those facing eviction. The COVID-19 eviction diversion program is designed for individuals impacted by the coronavirus who are in danger of being evicted. It is also designed to assist landlords as well. More details will be shared with the Board of County Commission tomorrow morning. You can watch our meeting live on Orange TV in order to see the full discussion. In terms of testing, free testing continues to be a priority in Orange County so that it is conveniently located for all of our residents. We received word today from the state of Florida Division of Emergency Management that they have committed to creating 5 mobile testing units that will move throughout the state of Florida in different communities, and one is slated for here within Orange County. And that mobile unit will be moving throughout our region and county, and we want Orange County to be the first county to have that new unit moving about. The mobile unit will serve both drive-up and walk-up clients. It is projected that they will see as many as 500 individuals each day, and it will be staffed by 14 healthcare workers. We are working aggressively with the state to identify a location and dates for when this site will be accessible to our residents here within Orange County. We anticipate getting the information soon, and we'll be passing that along through our communications division. Our Orange County Health Services testing site will be at the Econ Soccer Complex beginning tomorrow, August 11th, and run through Friday of this week. As a reminder, if you are testing at our Econ Soccer test site, you will get a free packet of face masks and hand sanitizer as well. Our PPE program has gone very well here within Orange County. To date, we have provided 1.5 million masks to the community, to include supplying some of our small businesses with PPE as well. I have been asked by numerous persons within our community to remind people that when you wear the face mask, to wear it properly. I know our Dr. Pino will tell you that that means it should cover both your mouth and your nose. And sometimes if you are like me, I see people who may have it around their chin. It's not covering their mouth or their nose, or they may just have it covering their mouth but not their nose. But it's supposed to cover your mouth and your nose. And then if you're like my soon-to-be 98-year-old father, he'll wear two. One will cover his chin, and the other will cover his mouth and his nose. If my dad is watching this, it's just a joke, Dad. Okay, but please make online appointments if you want to go to our econ location by going to ocfl.net/econ soccer. And then to give you an update on our strike teams, our business compliance teams that have been moving about the community. We told you that this week they'll be visiting some of the businesses that were not in compliance, but as of earlier today, they have visited some 800 different Orange County businesses, and they have seen a compliance rate of about 79%. So they will be going back, checking on some of the businesses that they have visited before, as well as new businesses this week. That's what you can anticipate that will be occurring. And with that, I'm going to turn it over to Dr. Pino.
Thank you, Mayor. Good afternoon. As the mayor said, Orange County had 31,851 positive cases. We have an accumulative percentage of 11.6. And we have a recovery rate has jumped to 91%, which is all good news. On the sad side, we have added 30 additional deaths to our roll. I'm going to explain a little bit about this. But our condolences really and thoughts are with the families of the people who have died. But the silver lining on this one, if we can find one, is that we haven't had any reported death since August 7th. Although that could happen later, we still have not seen any since August 7th. So to the mayor's point, yesterday and before yesterday, we have not seen any reported death. Of the 36 deaths, 30 have unknown conditions, 5 have not reported, and 1 was not identified. Now, of the 36, since we talked to you last, 10 had happened at long-term care facilities. Now, on those 36, on the total death, so we have 21 that were happened prior to August 6th that we saw you, but that were reported after. We have 12 deaths that has been reported on August 6th, and we have 3 that has been reported on August 7th. The age range was from 40 to 101, 17 female, 9 male, 1 Asian, 11 black, 7 others, 16 white, 1 of unknown, 9 Hispanics, 13 non-Hispanic, 14 unknown ethnicity. On the long-term care facilities, there are also some silver lining too. The Orlando Health and Rehabilitation Center, with a total of 216 positive cases over the pandemic, has seen 9 cases since August 6th. So it's a little bit of a slowdown there, which is a good thing. 88 were positive staff, 128 residents, and they have been not changing in the number of deaths. In Advante, Orlando, 94 has not been any new additions on that. For Terra Vista Rehabilitation Center, 91 cases, 4 since August 6th, 47 positive staff, 44 residents. Total number of deaths among residents, 3, 1 occurred on August 6th. Ocoee Healthcare Center, 94 total positive cases, 9 additional since August 6th. 30 in the staff, 64 among residents. There are no changes in the number of deaths. Colonial Lake Health, 76, only one additional case since August 6th. 35 staff, 41 residents, 8 total deaths, no changes in August 6th. With regard to the data, could you put up the graph, please? So this is our daily positivity rate. It continues to decline and go in the right direction. There is August 9th, that's yesterday data. Next. This is our incidence rate, and I want to call your attention because we finished week 32. And since week 26 to 32, we have reduced over 50% of our incidence rate in our community, which is quite significant. Next. And this is our hospitalization data. As of August 8 at 5 p.m., normally is the time, we have 71 ICU cases from 92 on the prior week. That's a significant reduction. COVID in non-ICU, 275 from 374, the last measure. And total hospitalized, that means both of them, 346 from 466. So in 7 days, we have reduced the number of hospitalizations by 100. Another interesting data is that last week, week 32, we have a negative growth of about 38% when we compare to the prior week. So there is clear a deceleration of the pandemic, a sustained deceleration of the pandemic in our county. I will answer any question that we have, and it's my pleasure to pass the microphone to Dr. Jenkins.
Thank you, Dr. Pino. Well, we are happy to say we have concluded the first day of school for the 2020 school year. It is a year like no other we have experienced, but nonetheless, we are pleased it has been completed. I want to thank our amazing teachers, our classified support staff, principals, administrators for their hard work and in getting us ready actually to start today. The board and I especially acknowledge 14,000 teachers who have to be in the front lines to get the work done. As many of you know, the first 9 days are specifically launched on our Launch Ed program. That is, every student who is eligible, 212,000 students here in Orange County, may use the virtual platform. I want to stress once again for those parents who were waiting for face-to-face on August 21st and have complications about getting online for these first 9 weeks, there is no penalty, no harm to those children or families if they do not log on for the first 9 days. Students are taught and interacting personally real-time with their teachers. Thank you for your understanding and support as we work through the glitches. So let's talk about the technology. OCPS actually has a vendor, AT&T, who is prepared for the increase of online traffic, but as always, there will continue to be adjustments made based on surges. We did experience some system slowdowns first thing this morning. There was a period of about 20 minutes or so where backup servers were turned on and our vendor reacted. Also, something they call redirect servers around 10 a.m. That's when high schoolers came on first thing and then when middle schoolers were added to the flow. Canvas experienced some slowdowns as expected during the heaviest periods. Listen to these numbers. They are a bit daunting. 756,000 launches of our application in OCPS took place today by 3 p.m. The vendor continues to monitor and adjust servers to improve system performance. As for video conferencing, around 9 a.m. we had reached 4,000 simultaneous concurrent sessions being conducted by our teachers with their students. Again, we appreciate the patience and understanding of our students and families. I'd like to reiterate a few troubleshooting tips. We'd like to encourage parents to certainly check with their service provider to make sure that the issue is not on their end, but also turn the device off and then turn it back on after about 60 seconds to reconnect. Most importantly, we want you to encourage students not to be anxious. No penalty, no problem if they have problems logging on. We will certainly accommodate that with compassion and understanding. So help our students to remain calm during these first days as we begin this journey. Next, I'd like to talk about our curbside meals. So because these first 9 days we are not actually open for students on campus, students eligible for free and reduced lunches certainly are still eligible. Those who wish to purchase know the usual routine where you log in and put money into your account online. All are welcome for curbside pickup 30 minutes after dismissal. Next, I'd like to mention our health and safety manual. We released our OCPS COVID-19 health and safety procedures manual, and already on Friday we launched 2.0 version. It is a living document. It will continue to be updated as we get information both from our health department and other experts. It will continue to be a growing document. 2.0 version is up now. In the coming days, I am certain we will have version 3.0. But a lot of questions that community members, parents, students, teachers, employees might have can be answered in that manual. It is found, a link is found on our homepage, ocps.net. Lastly, let me mention, currently we intend to have a return to face-to-face on August 21st. That is the current date for about 1/3 of our students who intend to take advantage of face-to-face instruction, and about 1/3 or more of our teachers as well. The other 2/3 have selected to remain on Launch Ed for the first 9 weeks. Keep in mind, Orange County Virtual School students have to remain on that platform for the first semester. Thanks again to OCPS families, employees, all of us working together to benefit our children here in Orange County. Please look on our homepage, ocps.net, for many resources, including frequently asked questions and Launch Ed resources for parents. You can follow OCPS on Facebook or Twitter. Thank you again for your patience and your support, especially to Grandpa Demings, otherwise known as Mayor Demings.
All right, thank you, Dr. Jenkins. At this point, we'll open it up for questions. If we have Spanish-speaking media here, if you have questions in Spanish, if you want a response in Spanish, Dr. Pino is fluent, and then we have Ms. Ilia Torres who can come up and translate for me, and we have 2 of our county commissioners who are here who are both fluent in Spanish, Commissioner Uribe and Commissioner Gomez-Cordero. I'm sure they will jump in as well to assist Dr. Jenkins, unless Dr. Jenkins is fluent in Spanish. So with that, we'll open it up for questions.
Lauren Seabrook, Channel 9. My question's for Dr. Pino. Dr. Pino, we talked about this a little bit earlier, but 2 weeks ago today, our statewide total results that were coming in on one day were about 85,000. Today we're at about 28,000, so significantly less. Obviously, it's great news that our numbers are down, but how does your staff weigh the numbers being down compared to such few amount of tests when you look at this week compared to a couple weeks ago?
So about today, I really don't know yet where the numbers were coming from. I haven't been in the office today, but when you see a reduction that is proportional in the numerator and denominator, then you have less of concern, because that means your data is stable. You are reducing or increasing in both directions. So that reflects what you don't want to see is, the other way, a few tests and then the positivity rate jumping too high. This could be many reasons. So it's Monday. It could be may have to do with the weekend. It could be that a lab is not reporting. Again, I don't have the answer. But as I mentioned to you by email, I find Wednesdays to be a better day for the whole week because it's right in the middle, and then anything that may have happened in the weekend could have been resolved. But probably when we talk next, we will have a clear answer of what was the issue that we got 6,000 tests less than prior days.
Steve Hudak from the Sentinel. This question is for both the mayor and for Dr. Pino. I'm sorry to put you both on the spot, but how close are either of you to supporting a plan by Orlando City Soccer to host matches with spectators at their stadium, or UCF to host football games with spectators?
So we have been in communication with both entities. Our EPIs visited both stadiums. They do present plans and ideas what they would like to do. Some things makes a lot of reasons. Other we have to review and make some suggestions. I don't think that we are at the point of having events of that nature. I think my major concern with these events, even when we can keep social distancing by seating arrangements, is coming in and egress and the volume of people bumping into each other. So we will have to find a solution for that as well.
I think that one of the reasons why you have seen the numbers steadily decline here is because of the different measures that have been put in place. I believe that they're working, so I don't believe that now is a time to relax any of those restrictions. I certainly will listen to our healthcare experts and the epidemiologists regarding this virus and consider anything that they would say in that regard. But I have not seen any specific plans for either one of the groups that you have mentioned going forward. So we'll reserve our final opinion about it until that time.
Por aquí Michelle Félix de Telemundo 31. Mi pregunta es para la superintendente de la... Hablamos sobre que hoy las escuelas iniciaron. El condado Orange fue el primero que inició con las clases virtuales. Oh. Ok, me voy al paso. Slow. Gracias. Michelle Félix de Telemundo 31. Mi pregunta es para la superintendente. El condado Orange fue el primer condado que inició sus clases virtuales. Sin embargo, muchos padres han tenido problemas para conectarse, para que sus hijos inicien la clase. ¿Por qué creen que ocurrió esto y cuál sería la solución en un futuro?
So the question is from Telemundo. Orange County Public School System is actually the first county to start virtual classes today. A lot of parents have reported having technical difficulties. What do you think are the cause of these technical difficulties, and what are the solutions?
So the cause is clearly volume, 212,000 students. Typically, when we reach August 21st, where some students are in person, the launch ed or the virtual volume will not be as large, but the cause... Just say, the cause is 212,000 students.
La causa es básicamente el volumen. Se registraron 212,000 estudiantes iniciando sesión en el sistema.
And it will get better.
Entienden que va a mejorar ciertamente. 212,000 sesiones.
Hey, this is for Dr. Jenkins too, sorry. It's Sam Sosa from Fox 35. So to go along with that, a lot of parents were asking who they should contact if they are having those issues, if they should contact anyone at all. From what I've seen on the Facebook page, you guys told them to contact their school directly, but do you guys have maybe plans to put some kind of tech helpline when parents are having these issues, or is there anyone else that they should be contacting, or not at all?
Sure. So with 212,000, we've asked folks to try a couple of troubleshooting on their own, a couple of strategies, including turn the device off and turn it back on after about 60 seconds, and make sure the problem is not with their service provider. We alerted all of our vendors, not our vendors, but service providers, that this extreme increase in volume was coming. And so we asked them to make sure they touch base with their provider to make sure the problem is not there. Secondly, or I should say thirdly, they can contact their school. There are tech service reps at every one of our schools that may be able to assist them. The school will also log the concerns so we can see if there are any trends. Quite frankly, for our first day, we thought it went phenomenally well. We expected some glitches and slowdowns, but the response was pretty incredible.
This is Kelsey Thord with West 2 News. Dr. Jenkins, this is a question for you as well, sorry. I know, the district has this lawsuit with the teachers union. What is the likelihood that kids are going to go back to school in person on August 21st? I know a lot of parents are still concerned about that. And then what are you also saying to teachers that are afraid for their safety going back and teaching in person?
So two things are important to understand. One, only about a third of our parents registered for face-to-face. 2/3 are going to use one of the virtual platforms, either Orange County Virtual or this new Launch Ed, which is real time with their teachers. What people also may not understand is about a third of our teachers also said they wanted to be in classrooms, in schools, face-to-face with their students. Another 17% said they want to do the Launch Ed program, but do it from school in their classroom, meaning if necessary, they could also accommodate a few live students as well if they needed to. So I think it's important to know that those numbers almost match up with folks who want to be on campus. Problem is, you can't get exact numbers, won't always match the actual classes being taught. Students won't always come in neat little bundles, and so principals and assistant principals are tirelessly working through those issues. When it comes to the CTA lawsuit, can't comment on pending litigation. That's pretty standard. I believe the union does what they believe they need to do. We believe we are mandated by emergency order to open schools in August for our students. It remains to be seen. I can't promise anyone what will change in the future, but as of today, we have not had a change in that August 21st date. Never been through this before. Cannot promise you there won't be future changes. That is all I can report to you as of today.
Hi, Megan Cruz from Channel 9. Thank you for staying there, Dr. Jenkins. Did anything unexpected happen today that you've since learned from and can address moving forward?
I want to repeat that one more time.
Did anything unexpected happen today? Because obviously you were saying, we expected volume to be an issue. Did anything unexpected happen that now you've learned from and can move forward?
No unexpected occurrences. Our provider, our vendor, has been on top of it. We've made adjustments. We think we had a pretty positive first day for over 200,000 potential sign-ons. It was a pretty good day. We expected some glitches. It will get better as the week carries on.
This next question was texted in from Lewis Bolden at WKMG. It's for you, Dr. Pino. Dr. Pino, do health departments have to go through one of the companies contracted with the state to hire contact tracers, or are they free to hire who they choose? And can you provide an update on the hiring of these contact tracers?
So the state had a contracting agency that has been providing for us about 39 contractors that are serving as a bridge while we hire the OPS positions, the part-time positions that with the resources offered by the county and the state from the CARE Act. On the hiring, we have selected the first initial 34 individuals, and they are going through the process. They have received an email, and we received about 300 applications for 100 positions. The issue is that they will have to get trained on IT policies and confidentiality because that database that they are going to have access to it not only has COVID-19, but it has other information about transmissible disease. So there has to be a clear understanding of HIPAA and privacy before people have access to that information. We are expecting that maybe next week, if we get a clear from the fingerprinting and other trainings, they will sure start it. We have created an office building that was empty, where used to be the CMS clinic. Next to our office is on Lake Eleanor. So we created a space for 120 additional employees. It's all set up, technically capable, and it's called CORE, COVID Response Center for Orange County.
And this last question that was texted in is for you, Mayor Demings, from Ryan Lynch with Orlando Business Journal. Mayor Demings, has the county recorded an updated number for the percent of women and minority-owned businesses who have received grants through the CARES Act business program?
The last numbers I saw, it was somewhere around 71%, but I have the program manager here, Mr. Ushkowitz, so with the numbers that came in today, that might have shifted a bit. So, Eric, if you have some updated information.
We don't have updated information on the minority dispersion right now, but we'll have it for the board meeting tomorrow.
Hey, thank you. Eric Mock, Spectrum News 13. Question for Dr. Jenkins again. Get you back up there. Sorry, I wish I could have got it in when you were still up there. You know, I've been talking to a lot of teachers, and like you said, it was you know, going to happen with some technical glitches with this much volume, but a lot of them feel like the district should be investing more in increasing bandwidth or increasing the technological capabilities. So is the district after today going to look at investing more in increasing the bandwidth, or is it just that, you know, do we even have the technological capability to have 200,000 students on the same program at the same time?
The district already increased bandwidth. AT&T is our vendor, our service provider. Expected the increased volume. We've prepared for that. And it will only continue to get better this week.
But even with the increased volume, wasn't there still a lot of slowdowns and stuff and glitches with the?
No, what I mentioned was high school initially, they turned on additional servers. Middle school, another glitch, they used some backup servers. It was expected. And so we're not scrambling at this point. We were scrambling a few weeks ago to make sure we had increased broadband width.
Okay, are there any questions for Commissioners Uribe or Gomez-Cordero? It looked like they got off easy today. All right, thank you all for being here. Hopefully this has been informative.